What happens if now open enrollment is closed and now you find out that you need a expensive drug, for example, that wasn't really covered on the plan that you might have selected prior when open enrollment was open? How is somebody supposed to deal with that?
Yes, and unfortunately, this does happen. We don't have a crystal ball at the time of selecting your plan. You may be completely healthy, and then in January, February, the middle of the year, you start being prescribed something that's a brand drug. There's several ways that you can mitigate this. First of all, a lot of people have heard of like GoodRx and CleverRx. And this is something that even people who maybe miss open enrollment and they don't have any coverage, they can use those discount copay savings card type things. The other thing too is talk to your pharmacy, because a lot of times Walmart or Walgreens, they'll have their own program where you can get 90-day supply prescriptions for, $10. So I'm not saying don't buy coverage, but if you're stuck, there are other ways to get your prescriptions. There's also rxassist.org, where you can actually apply for patient assistance. And what that is if it's a really expensive brand drug, some of these drugs I'm seeing cost, $8,000 for a month's supply. I don't know who could afford that, but you can go through that website, download a form, and you're basically applying for help through the manufacturer. If you're under a certain income level, you could get that prescription for free. Also, there's something called the 340B program that a lot of people don't know about. It's certain clinics and hospitals that are able to give patients, 20 to 50% off discount, because it is subsidized by the program, for some really expensive drugs. So you might want to get with a broker that is knowledgeable about those programs, who can direct you. Here's a list of hospitals that you can reach out to. And if you're on Medicare, you can ask your broker for help. Ask them for help applying for a formulary exception or a tier exception, which might help you get through till the end of the year when you can reshop again.